Hongishin. So now I'm gonna inject IV running injection. So I'm gonna check. So primary line is running at the moment, and I'm gonna first perform my first check with 6 rights. So I check my patient and medication in MAR. So I check this is right patient, right medication, right time, right route, right dose, and right medication in MAR. And I'm gonna do my 6 rights too. And after that, I can pull my medication, and at which point I can do my second check. So I check. Yeah, so when all the medications are off, I do my second check and with 6 rights. And I'm gonna also look for any patient allergies, and I'm gonna look into my drug book too, so I know what medications, actions, and adverse effects, contraindications, and actions, things like that are. So today my order is morphine 10 milligram, but this is morphine 20 milligram per milliliter. So I need to pull 0.5 from here, and at this point I can prepare my medication. So in reality, I'm gonna use all sterile equipment, all new ones. So I'm gonna check there is no tear, and it's not opened, and expiration date is not due. And I'm gonna check with all my equipment, including my medication. And first I need to clean off my medication top for 15 seconds.
Like I said, my order is for 25.
And then I'm gonna connect my needle
It's not expired. There's not any discoloration or any cracks in the vial. And then I'm going to go ahead.
And since I'm going to inject 0.5 milliliter of the medication, I aspirate the same amount of the air.
The lab station is, but I know that it's not expired. Like I said, normally it would not be open. Normally I would be drawing this.
And then since I already cleaned it off,
because I'm not going to be giving it with the needle. So that
inject the air.
Injuries and other things, but for the sake of this video, I will be using this for the lab supplies.
0.5
I know that this needle is not expired.
milliliter
it's okay to use for me to pull out the medication.
of the medication morphine.
So now I can go ahead and I can clean off my vial.
And I make sure there are no air bubbles
I'm going to let
inside.
this sit for about 15 to 30 seconds, and I'll let that dry.
And morphine is to alleviate the pain of the patient, so this matches the purpose of it. And now I can go to my patient's room. So in my patient's room, I check the patient by 2 identifiers, by name and date of birth. So I ask the patient and I check them in the wristband too. And when that matches, I scan the band too, so that confirms in MAR as well. So at this point, I need to do my third stage check along with 6 rights. So I know this is correct patient, correct medication, correct time, correct dose, correct medication, going to the correct patient. And
So I'm going to go back to the 2.5.
so I'm gonna tell my patients about the medication. So this is morphine 0.5 milliliter. So this is to alleviate the patient's pain level.
I have gloves. You have? I grabbed them,
I
and I really forgot.
Use my gloves. And I already checked the room is safe, bed is locked in the lowest position. And I asked the patient if he has any questions, he can ask me so that I can answer in the meantime. And I'm gonna assess the insertion site first. So I don't note any signs of phlebitis or inflammation, leakage. And I'm gonna palpate for pain assessment and temperature too. And I don't find any abnormal here. And I'm gonna pause my pump for my injection. And I clean the pores about 15 seconds. And I know it's already unclamped because the primary IV has been running. And before the medication, I need to flush first so that I see the tubing is patent and the fluid not leaking out. So after I confirm them, clean it for about 15 seconds again. And I pinch the other side of the tubings to prevent any backward flush. And I can medicate morphine now. And I'm gonna remove the needle and connect them in thorough manner. And the push rate is 10 milligrams of morphine per 5 minutes. So I'm gonna, using my watch, I make sure that this 0.5 milliliter of morphine goes over 5 minutes. So it will be pretty slow, but for validation purpose, I will pretend I have done so. And I want to clean the valve again for 15 seconds. And after the medication, I also flush the normal saline at the same rate as the medication, so that the medication is actually has gone to the patient, not staying inside the tubing. So I pinch again. Again at the same rate, so 5 minutes per 4.5 milliliter. So I check the medication went through the patient's skin. And I'm not gonna clamp this time because I'm gonna restart my primary IV again.
I know that this isn't what I'd be using in normal practice, but I know that the line is right here. As I want to show you one more time. This is the 2, this is the 3, right here would be the 2 ends.
I'm gonna clean this again, and I'm gonna ask patient if he has any questions or if he has any pain during the procedure, and I'm gonna also physically check the insertion site for any liquid bleeding or redness, things like that. And I don't see any, so I do perform hand hygiene, and that concludes.